Do you frequently feel like your heart pains sometimes? Or maybe your fingers tingle out of nowhere? What if I told you these little signals from your body might be pointing to something deeper, like your blood making too many platelets? That's where essential thrombocythemia, ET, comes in. ET is a rare blood problem where your bone marrow, the factory inside your bones that makes blood, goes into overdrive and produces too many platelets, the tiny cells that help your blood clot. Now, clotting is good when you're cut, but too many platelets. That can lead to clots where they shouldn't be, like in your heart, brain, or hands. Think of it like having too many workers in a kitchen. Someone's bound to trip. And strangely, even with too many platelets, some people bleed more easily. Sounds confusing, right? That's why understanding ET matters, especially if you're feeling odd tingles, headaches, or unexplained bruises. So what causes this overproduction of platelets? Scientists have found that in most ET cases, a simple letter change in your DNA, like a typo, in a long instruction manual sets things off. The most common typo happens in a gene called JAK2. This gene is like the gas pedal for blood cell production. When it's broken, the pedal gets stuck, and your body keeps making platelets nonstop. Other genes like CALR and MPL can also have similar typos. But here's the thing, these changes aren't passed from parents to kids like eye color. They just happen during life, like a glitch in your system. You didn't cause it by diet, stress, or lifestyle, it's just bad luck. And fun fact, most people with ET don't have any family history of it. So if your mom doesn't have it, you're not automatically safe. And if she does, it doesn't mean you'll get it either. It's mostly a solo journey, not a family tradition. Now imagine this. You wake up and your left hand feels tingly, like it's asleep, but you haven't been lying on it. Or maybe you get frequent headaches that don't go away with painkillers. Some people with ET even report redness and burning in their hands or feet, called erythromelalgia, which feels like walking on hot coals. Sounds scary, it can be, but others feel totally fine. That's the tricky part. ET often shows no symptoms at first. But when it does, it plays two opposite games: too much clotting or too much bleeding. Clots can lead to strokes, heart attacks, or swollen veins. Bleeding might show up as nosebleeds that won't stop or gums bleeding when you brush your teeth. Some women find they have heavy periods. And if you've ever had an unexplained blood clot with no risk factors, like being young and healthy, ET might be the hidden suspect. So ask yourself, have you had any of these weird episodes others don't talk about? First, they do a simple blood test, a complete blood count (CBC). If your platelet count is over 450,000 per microliter and stays high over time, that's a red flag. But high platelets can also come from infection, iron deficiency, or inflammation, so doctors dig deeper. They'll test your genes, JAK2C, ALR-MPL, to find the typo. Sometimes they take a small sample of bone marrow and needle into the hip to look under the microscope. That sounds intense, right? But it's like checking the factory's blueprint to see what's going wrong. If ET is confirmed, treatment depends on your risk level. Are you over 60? Or did you have a clot before? Then you might need medicine like hydroxyurea or anagrelide to slow down platelet production. For others, a daily low-dose aspirin might be enough. It thins the blood just enough to prevent clots like oil in a rusty machine. The goal: avoid strokes, heart problems, and keep you living normally. Can you stop ET before it starts? Sadly, no, because the gene changes happen randomly. There's no vaccine or lifestyle switch to prevent it completely. But you can prevent complications. Think like a superhero with a weak spot. Your power is your body. Your kryptonite is blood clots. So drink water often. Dehydration thickens blood. Avoid smoking. It damages blood vessels and raises clot risk. If you're on birth control pills or sitting on long flights, talk to your doctor. These can increase clot danger. Regular checkups and blood tests, gold. Catching high platelets early means you can act fast. Eat healthy, move daily, and know your body. If your fingers burn or your head pounds too much, don't ignore it. Prevention isn't about avoiding ET, but avoiding its harm. Science is moving fast. Researchers are now testing new drugs that target the JAK2 gene more precisely, like smart missiles instead of old bombs. Drugs like interferon alpha are showing promise, especially in younger patients, because they may even reverse the gene issue in some cases. Another cool advance, liquid biopsies, a blood test that picks up genetic mistakes without needing a bone marrow needle. Imagine getting diagnosed with just a finger prick. Also, scientists are studying why some people with gene mutations never get sick. Maybe their bodies have natural shields. Learning this could lead to natural treatments in the future. Right now, clinical trials are exploring ways to stop ET from turning into more serious blood cancers. So while ET isn't curable yet, the future isn't dark. It's full of clues and hope.